You took a pill this morning. You probably did not think twice about it. It took about 10 seconds. You have done it the same way every single morning since your doctor handed you that prescription. And if you are over 60 and that pill is Amlodipine, Losartan or Lisinopril, there is a very real chance that something is happening inside your body that nobody properly explained to you on the day you were handed that bottle. His name was Arthur, 76 years old, retired school principal from Alabama, disciplined, proud of how carefully he had managed his health into his 70s on Amlodipine for blood pressure, not a misdose in 14 months. His wife Eleanor called me on a Tuesday afternoon. Her voice was flat with worry. "Dr. Eric, he has stopped going to church. His ankles. I do not even recognize his ankles anymore." Arthur had not had a heart attack. He had simply been sitting with swollen ankles for 3 months, convinced his heart was failing, skipping doses on the days he needed to walk because he was embarrassed by what his legs looked like. That silence almost cost him everything. My name is Dr. Eric, a cardiologist. With over 32 years of clinical practice, what I'm about to share with you are the 9 most important things every senior on these 3 medications needs to understand. Not because your doctor is hiding anything from you, but because a standard appointment gives a physician 12 minutes to explain something that genuinely deserves much longer. Before we go further, drop your age in the comments right now and tell me this. Have you noticed any symptoms since starting your blood pressure medication that you quietly wrote off as just getting older? I want to know because what you write is going to matter to someone reading it who thought they were completely alone. If honest, clear guidance is what you have been looking for, subscribe right now. I publish every week for seniors who want real answers about what is happening inside their body. Most seniors remember the same experience, a consultation that lasted a few minutes, 2 words across a desk, high blood pressure, then a prescription once a day, come back in a few months, no explanation of what changes inside your vessels, no discussion of how a body at 70 responds differently than a body at 45, just a simple instruction that sounds final. And most people walk away believing something incomplete, that the medication is fixing the problem. The truth is more precise than that. There are 9 things I want to walk you through. The 9th is the most important. Stay with me all the way to the end. What these 3 medications actually are and why they are not the same. Amlodipine, Losartan and Lisinopril all lower blood pressure, but they do it through completely different systems. Those different systems create completely different side effects and completely different warning signs. If you do not understand that, you will misread what your body is telling you. Amlodipine, the calcium channel blocker. Your artery walls are surrounded by smooth muscle. That muscle tightens based on one trigger: calcium entering the muscle cells. When calcium flows in, the artery narrows and blood pressure rises. Think of your artery wall as having small entry gates for calcium. Amlodipine reduces how many of those gates are open. Less calcium, less tightening, pressure falls. But it does not remove the reason those vessels became tight in the first place. It manages the output of the system, not the cause. Lisinopril, the ACE inhibitor. Your body produces angiotensin II, a substance that tightens blood vessels and signals your kidneys to hold on to more fluid. To make it, your body needs an enzyme called ACE. Lisinopril blocks that enzyme. Think of it like shutting down the factory that manufactures the tightening signal. No factory, no signal, lower pressure. And because it also reduces workload on the kidneys, Lisinopril is often chosen for seniors managing both blood pressure and early kidney concerns. 1 drug, 2 protective effects. Losartan, the ARB, angiotensin receptor blocker. Losartan works on the same system as Lisinopril, but at a different point. Lisinopril stops angiotensin II from being made. Losartan lets it be produced, but blocks the door it needs to enter to tighten your vessels. The signal is sent. The door is locked. The message never gets through. The key difference: Lisinopril causes a dry, persistent cough in a significant number of patients. Losartan does not. This is why doctors switch patients, not because one is stronger, but because a cough at 2 a.m. every night is not something any senior should suffer through when a simple switch exists. The Amlodipine ankle swelling and what it really means. This is the conversation Arthur should have had before he ever stopped going to church. Amlodipine relaxes the small arteries in your legs more effectively than it relaxes the small veins. Blood flows down easily. It struggles to flow back out. Fluid shifts into the surrounding tissue. That is why your shoes fit in the morning and feel tight by 6 p.m. That is why the swelling is gone by morning and back by evening. It is not heart failure. It is not kidney damage. It is a predictable mechanical consequence of how this drug acts on the vessels in your lower limbs. What made Arthur's situation dangerous was not the swelling, it was the silence. He started skipping doses because he was embarrassed and his blood pressure climbed in silence for 3 months. Report swelling. Do not hide it. Skipping doses is far more dangerous than any swelling you have been living with. The Lisinopril cough and the warning sign you must never wait on. If you are on Lisinopril, have you developed a cough since starting it? Not wet, not productive, dry, scratchy, tickling, a cough that nothing clears. The critical thing, it does not always start right away. Sometimes it appears months after beginning the medication. By that point, patients have completely stopped connecting it to the drug. They blame allergies, reflux, dry air. They buy lozenges, they change their detergent, and the answer is in their pill organizer every single morning. Patricia was 69. 4 months after starting Lisinopril, she developed a tickle in her throat that would not leave. Sleepless nights, exhaustion. She replaced everything in her home. When I asked when the cough began relative to her medication, she went completely quiet. Nobody had told her the Lisinopril cough can arrive late. A dry cough is uncomfortable. It is not dangerous. Report it. But there is one symptom that cannot wait. Swelling of the lips, tongue, face, or throat, especially if breathing or swallowing becomes difficult. That is emergency care immediately. ACE inhibitors can, in rare cases, cause angioedema, and it can become life-threatening within minutes. Dry cough, report it. Throat swelling, move now. The potassium danger that is not in your medicine cabinet. Think about your kitchen, not your medication. Your kitchen, because one of the most serious risks for seniors on Losartan or Lisinopril is sitting on your counter right now. Both medications can raise potassium levels in your blood. When potassium climbs too high, it affects the electrical rhythm of your heart. The symptoms do not always announce themselves. Muscle weakness, occasional cramping, a skipped heartbeat, sometimes nothing at all until it is serious. Salt substitutes labeled heart healthy replace sodium with potassium chloride. Electrolyte powders, senior meal replacement drinks. Every one of these quietly adds potassium to a body whose medication is already retaining it. Bernard was 74. He switched to a potassium salt substitute because he thought he was doing the right thing for his heart. He was on Losartan. Nobody connected those dots. He started feeling weak. His potassium came back dangerously high. Bernard was not careless. The gap was not in his discipline. It was in his information. Read every label on every heart-healthy product in your kitchen. Ask your doctor, given my medication, is it safe for me to use a potassium-based salt substitute, the pain reliever in your bathroom cabinet? Check your bathroom cabinet the moment this video ends. Look for ibuprofen or naproxen. If you are taking Lisinopril or Losartan, especially with a water pill, regular use of these medicines can reduce blood flow to your kidneys and increase the risk of kidney injury. Not because any one of them is dangerous alone, because together, in a slightly dehydrated body, they create conditions the kidneys struggle to manage. Nobody mentions this at appointments because ibuprofen does not feel like a real medicine. It came from a shelf, so it never gets brought up. Ask your pharmacist this exact question. Is it safe for me to use ibuprofen regularly given all the medications I'm on? That conversation is free. It may prevent a problem nobody saw coming because nobody thought to ask. What happens to your medication when you get sick? If you are on Losartan or Lisinopril and you get sick, vomiting, diarrhea, heavy sweating, unable to keep fluids down, the medication that worked perfectly yesterday may behave very differently today. These medications assume a body with stable fluid balance. When illness strips that away, the same dose can now drop your blood pressure too far and stress your kidneys. The medication did not become dangerous. The body it was working inside changed completely. Gerald was 78, stomach virus, could not keep much down. Still took his Losartan every morning because he had not missed a dose in 13 months. That night he stood up and nearly collapsed. The problem was not the medication. His body was depleted. His blood pressure had dropped too far. Write this down and put it where you will see it when you are unwell. If I cannot keep fluids down, I call my doctor before I take my blood pressure pill. The most dangerous blood pressure reading is not the highest one. The most dangerous blood pressure reading is not the highest number you have ever seen. It is the one you took at the wrong moment and made a decision from. Blood pressure moves constantly with sleep, stress, caffeine, posture, and the anxiety of checking it immediately after worrying about checking it. A single reading is not a verdict. It is a snapshot. Diane was 67. She checked her blood pressure every time she felt anxious. Page after page of numbers, heart full of fear. She was certain her Lisinopril had stopped working. When we slowed everything down, same time, same arm, rested for 5 minutes, a completely different picture emerged. Her medication was working. The chaos was in the method, not the medicine. Measure at the same time every day. Same arm, same chair. 5 minutes rest first. React to patterns, not moments. One number is noise. A pattern is information. Only information deserves a decision. The hidden environment your medication works inside every day. 2 patients, same age, same medication, same dose, completely different results. I have seen this across 32 years. The medication is identical. The body it is working inside is not. High sodium means more pressure building inside your vessels. Your medication works harder just to hold the same ground. Poor sleep raises stress hormones that tighten the very vessels your medication is trying to relax. Excess weight adds cardiovascular pressure. No single medication fully compensates for inactivity, stiffens artery walls over time. When your medication and your internal environment are aligned, results are stable. When they are not, doses climb, not because the medication is failing, because the system is working against itself in 2 directions at once. The best outcomes are never medication alone. They are medication plus the environment it is working inside. The truth almost never said on the day. The prescription is written. In 32 years, after thousands of appointments and thousands of prescriptions, the single most important truth about these 3 medications is the one almost never said on the day the prescription is written. None of these medications erases the condition producing your high blood pressure. Amlodipine reduces how tightly your artery walls contract, but it does not remove the stiffness that built in those walls over decades. Lisinopril blocks the enzyme producing the tightening signal, but it does not repair the vascular changes that made those signals too frequent. Losartan locks the door the signal needs to enter, but the signal is still being sent. All 3 medications manage the output of the system. They do not erase the system producing that output. This is why follow-up matters more than the first prescription. This is why lifestyle is not optional. This is why a perfect number on paper does not mean the conversation is over. The patients I have seen do best are not the ones on the most medications. They are the ones who understood what their medication was doing and what it was not doing, and chose to work with both truths at the same time. The practical framework. If you take Amlodipine, watch for ankle swelling worse by evening, dizziness when standing, flushing, report it. Never skip doses to hide it. If you take Lisinopril, watch for a dry, persistent cough, even if it starts months later. Red flag that cannot wait, any swelling of lips, tongue, or throat. Emergency care immediately. If you take Losartan, read every heart-healthy label in your kitchen. Watch for muscle weakness, cramping, irregular heartbeat. Ask when your potassium was last checked. For all 3, never use ibuprofen regularly without telling your doctor. Call before your next dose if illness causes fluid loss. Measure blood pressure consistently, never reactively. Never stop suddenly without speaking to your doctor first. Let me tell you what happened to Arthur. After Eleanor's call, I adjusted his dose, reviewed what he was eating, and sat with him, not his chart, with him, and explained everything I have just shared with you. He learned why his ankles were swelling. He learned it was not his heart. Within 3 weeks, the swelling was managed, his blood pressure was stable, and Arthur was back at church on Sunday morning. He told me at his follow-up, "Dr. for Bennett, I spent 3 months convinced I was dying from something that had a name and a simple answer. I just needed someone to explain it." 6 months later, he handed a 1-page summary to 23 men at his Sunday group. 5 went to their doctors with questions they had never known to ask. 2 had medication adjustments long overdue. 1 had been experiencing dizziness on Amlodipine for 7 months, writing it off as just getting older. The information existed. The fix existed. The conversation simply had not happened yet. That is what this channel exists to do. After 32 years in cardiology, the one thing I know with absolute certainty is this. The seniors who manage their blood pressure best are not the ones on the most medications. They are the ones who understand what is actually happening inside their body, and use that understanding to make better decisions every single day. Arthur did not need a different medication, he needed a conversation. Patricia did not need to suffer through months of coughing, she needed one question answered. Bernard did not need to stop eating well, he needed to know what was already in his kitchen. Information is not extra, information is part of the treatment. Now, I want to ask you one question. Which of these 3 medications are you currently taking? Amlodipine, Losartan, or Lisinopril? Just type the name in the comments. That single answer tells me what matters most to you and what I break down next. And before your next blood pressure reading, carry this question with you. Do I actually understand what my medication is doing inside my body right now and what it is not doing? If the answer is not fully yes, that is not your fault. That is the gap this channel exists to close. I am Dr. Eric Bennett. Subscribe so you never miss the guidance your health deserves before the emergency you never saw coming, and I will see you in the next.